Minnesota in particular is sort of a hotbed of MS, and there's a big need. There's not a lot of MS specialists.
So this is a relatively new fellowship program that we have been very excited about getting underway.
This is a clinical MS fellowship aimed at training specialists in the care of multiple sclerosis and other related diseases, basically inflammatory diseases of the central nervous system.
We have now 3 faculty members who are all fellowship-trained MS specialists, along with a large population of patients with multiple sclerosis and other neurologic autoimmune diseases.
So there's several locations. There's the Clinics and Surgery Center here on the East Bank, University of Minnesota campus. But we also see patients at 2 other locations. One is Woodbury and the other is in Maple Grove.
The University of Minnesota is a tertiary care referral center that gets patients not just from the Twin Cities metro, but from much of the state of Minnesota, Wisconsin, and the Dakotas. So we have this really broad range of pathologies.
The most important thing in a clinical MS fellowship is seeing a lot of patients with MS and related disorders, ideally from several different perspectives, so that they can sort of pick and choose the best from all worlds. Rotations through other specialties that we work with as MS doctors all the time. The Department of Neurology as a whole is very strong. There's educational activities, grand rounds, what's called Friday School, which is our didactics for our residents that the fellows welcome and encourage to take part of. There's a world-class Center for Magnetic Resonance Research. There is some time, typically 10 to 20%, again, it sort of evolves, that is dedicated to research and administration. So we expect all the fellows to do a research project on something to do with MS or neuroimmunology. If a trainee is interested in some research project that's really outside of our collective area of expertise, that we would help them find a research mentor outside of our division.
One of the advantages of this very small family that we have in the fellowship is that we get to know the fellow very closely on an individual basis and can discuss that person's individual career goals and what would make the most sense for the fellow.
As the fellowship year progresses, the fellow gets start seeing patients in a more and more independent manner. So with more, instead of direct supervision from the faculty, they have indirect supervision where the faculty's there, they can discuss every patient, but they're not actually seeing the patient themselves. And the trainee is doing all the billing, is ordering the tests and getting the results and interpreting them themselves. So by the end of the year, I think they're really well prepared, not just with the knowledge to take care of these patients, but just the practical skills to do so.
The Twin Cities is a very diverse community with many of the amenities, but it also has a very livable feel.
Minneapolis-St. Paul is a great, vibrant city, good restaurant scene, great music scene, wonderful outdoor activities, great place to live and work.